Sophie, we're going to do a quick fire gut issues and symptoms, a gut glossary, if you will. Okay, so what is an allergy?
So an allergy is where you have an immune system reaction to an inappropriate immune system reaction, I should say, to something common in the world. So common things might be dust mites, pollen, those sorts of things that people will have experienced. And that's a true physiological reaction that you're having within your immune system. That could be peanuts, it could be these other things where your immune system flares up completely and you can end up with anaphylaxis and all these kinds of things. Or it could just be the annoying hay fever type symptoms that people are more familiar with.
So what's that versus an intolerance?
Intolerance is generally caused by changes to gut bacteria that mean that you're no longer able to digest that particular food as well as you used to. Or it could be just that the more of that food you have, the more uncomfortable you have symptoms from. The more you have that food, the more uncomfortable your symptoms are. And it's not life-threatening. It's not going to cause you any physical harm, but it's not going to be very comfortable if you have it.
And intolerance tests. Nonsense?
Absolute nonsense, yeah.
Whoa, she's gone there.
So I think maybe not last year, maybe the year before, the ASA released a response to a very well-known intolerance testing brand saying that they weren't allowed to call themselves intolerance tests because they absolutely can't diagnose them. There's no science behind it. They do an IgG finger prick sample normally, and we all have a completely normal IgG reaction to everything that we eat. So what the intolerance tests show is that all the foods that you normally eat, you're intolerant to. You can't eat them anymore. And that's dangerous because either you follow that advice, you change everything in your diet completely. And imagine how stressful that would be to be like, oh, I can't eat wheat anymore. I can't eat dairy. I can't have any of these things that I normally eat every day. Of course, that causes huge anxiety. I've seen probably 5 patients over the years that end up in hospital after following food intolerance test stuff because they've become so malnourished, horrible vitamin deficiencies. Because you don't get any like, make sure you replace your dairy with proper calcium. It's just like, here's your list of things you can't eat anymore forever. The worst case scenario is that people follow it. The best case scenario is they go, I can't do this, and ignore it. And literally, it's not worth the paper it's printed on or the
Or the
PDF
money.
that's in.
Keep your hair on your head and your spit in your mouth.
It's cheaper to come and see us. There's also these wild ones now, which are like magnetic resonance testing, where it says you can use a strand of your hair. And some
Is there not one where you can like hold
that.
like a sort of dildo looking thing?
I know what you mean. Yeah, I think that's in a similar thing. I can't remember what they call it. Something testing, obviously. And you hold an orange in one hand or a piece of fruit in the other hand, and it says, oh yeah, you're much stronger when you're holding the orange than when you're holding the piece of bread. I mean, the sad thing is, we laugh about it, and obviously it's nonsense.
Would have fallen for it.
Yeah,
100%.
sure. Yeah. I think that they make it seem so credible. The ones where it's a hair strand and they say they're doing magnetic resonance on it. I bet they're doing absolutely nothing. I bet they're doing nothing in those labs. There's no test that could possibly show a food intolerance from that kind of thing. There's
Just
no
gathering
science.
locks of hair for fun.
It's so weird.
Making wigs. Maybe they're making wigs.
Maybe, yeah. Multicoloured wigs.
Yeah. Okay, dysbiosis.
Dysbiosis is a term we use to describe unfavourable changes to gut bacteria.
Candida.
So Candida is a alternative medicine type diagnosis that people might make when they're trying to sell you loads of supplements and things to kill Candida. We all have Candida living on us and in us. They're yeast cells. Some of them are really beneficial. Some of them are less beneficial. But you absolutely don't have Candida overgrowth ever. Come and see a dietitian if you've been told that's your diagnosis, because we'll diagnose you properly.
Diverticulitis.
Diverticulitis is a condition I see so much of, very well known in the diverticular community, I'll have you know.
Oh, she's big in the diverticulitis game.
It's actually very common. So up to 80% of people over 60 will have diverticular disease.
Wow.
Yeah, it's hugely common. In your colon, you've got these circular rings of tissue, which we call donuts of cartilage. And you can get little hernias, essentially, where a little bit of tissue pockets out from there. And in those pockets, things can collect that we don't want to, bits of old food, bits of poo, things like that. And then they can rot and cause sepsis and cause real problems. In an ideal scenario of diverticular disease, you've got lovely gut bacteria that's really anti-inflammatory living in all those little pockets, and it protects you. But of course, lots of people don't. And the treatment for diverticulitis, which is a flare of diverticular disease, is loads of antibiotics, which we know isn't great for our gut bacteria. Thus begins a cycle where things can get really tricky. So it's a very common condition, nothing to worry about necessarily, and very manageable for most people most of the time.
Crohn's disease.
Crohn's disease is part of our inflammatory bowel disease family. Crohn's disease is differentiated from ulcerative colitis, which is just the colonic form, in that Crohn's disease can occur anywhere from your mouth to your anus, and it could also affect the full thickness of the bowel wall, meaning it's capable of sort of perforating between one piece of bowel into the other, So it's not necessarily worse than ulcerative colitis. Ulcerative colitis can also be life-limiting, but Crohn's is very difficult to manage in a different sort of way.
Gastritis.
Gastritis will happen to everybody who goes on their holidays, drinks too much white wine, doesn't eat properly, eats lots of fatty food, and then gets a bit of uncomfortable burning tummy afterwards and could lead to some reflux. So it's essentially where there's an irritation to the lining of the stomach, usually caused by lifestyle factors that have created too much stomach acid and irritated
Been on
the
the
lining as
bevy.
well.
When you've been on the
Been on the
bevy.
bevy. It's not always that. Can happen for lots of different reasons as well, but most people would have experienced it at some point.
Is that the same as heartburn?
Similar to heartburn, yeah. So you would experience like a discomfort in your upper digestive system. So feeling a bit discomfort up here. You might notice a bit of acid reflux or acid coming up into the mouth, or discomfort through your sternum and esophagus.
So reflux is when it comes all the way up.
Yeah, but some people have like silent reflux. They don't know it's reflux. They're not tasting it in their mouth or experiencing it, but it's still happening. But you would probably have symptoms of that in terms of discomfort through your chest or in your tummy.
And we speak about this one quite a lot colloquially, but I don't know how common it is. Stomach ulcers.
Yeah, I mean, they're reasonably common. It's something we need to think about. The sort of worst case scenario of gastritis, it continues to self-perpetuate because of stomach acid and everything. A bit like having a cut on your hand that you keep putting acid over, or lemon juice. It's going to keep getting more and more sore. It's not going to heal very well. Gastritis then can lead to stomach ulcers. There's also a bacteria called H. pylori, which causes stomach ulcers for people. And so, yeah, it's reasonably common, not wildly common, but it's something we do need to be conscious of.
Hemorrhoids or piles?
Yeah, it's so common. Loads of people have them, particularly after childbirth, but I see plenty of men with hemorrhoids and piles as well. They are essentially blood vessels that have become enlarged, and they can either pop out of your bottom and hang out of your anus, or they can be inside and cause bleeding. And so, if you notice blood on paper when you're wiping, or there's any blood in the toilet, that's usually the diagnosis. But always important to get checked.
Get that pessary up there.
Mm-hmm.
Gallstones.
Gallstones are little stones that form in your gallbladder. I'm an excellent person at diagnosing gallstones just off people telling me about their symptoms. So I like to think I've got X-ray vision. Essentially, your gallbladder sits just under your right rib. And so what you'll experience if you've got gallstones is pain after eating. And it's usually will be triggered more so by fatty foods. So the higher the fat food you're eating, if you have fish and chips and you have this awful pain under your right rib, 90% of the time it's going to be gallstones. And for lots of people, they'll just pass naturally. Other people have to have them broken up with an ultrasound machine, and some people have their gallbladder out so that their gallstones don't happen anymore. And what's happening when you have that pain is that your gallbladder is contracting on stones. So it's really, really painful when that happens.
Hernia.
A hernia is a protrusion of bowel through the abdominal wall. And so a hernia, if you imagine like if you open up your finger, I don't know how to describe this. If you have a gap in your abdominal wall because of pregnancy, so your stomach muscles have parted.
Women are incredible.
Yep, women are incredible. Or because you've had bowel surgery of any kind, or sometimes people get an inguinal hernia where the just separation of the two muscles in the groin just allows for a little knuckle of small bowel normally to poke through there. And that's sometimes okay, and you can just live with it. Some people also have an umbilical hernia. Lots of my patients have a peristomal hernia. So essentially, where there's any opening in the in the abdominal wall, you can have a hernia. What do I want to say to you? So you've got this knuckle of bowel that pokes through there, and but sometimes that's absolutely fine, doesn't cause you any problems. Other times it can become strangulated, so it can become restricted, and sometimes it can become cause a blockage in your bowel and things like that. So lots of times it's fine, sometimes it's not. Always get it checked out and always get it repaired if that's been recommended.
Prolapse, basically when your bumhole collapses into your foof. What's that called, and is it a thing?
Yeah, so you can have a prolapse which is called a rectocele, where the colon, the rectum, I should say, pushes backwards into the vagina. And so when you're trying to poo, it's going backwards instead of coming down and out the rectum. And it's so common, happens to lots of women post-childbirth, can be during the menopause, it can't happen to men, but it can happen for all kinds of different reasons. And it's a difficult thing to manage. You get this feeling like you need to poo all the time. We call it tenesmus, where there's this feeling you need to poo, but you can't get it out. It's really annoying. Or you sat there straining, but it's not going anywhere. It's not moving. And you can have a repair of that if you want to, but it's a fairly big procedure. there is a special tool where it's a bit like a shoehorn, and you pop it. It's got a handle and a little up bit, and you pop it into the vagina and gently push back, and that obviously straightens up the canal and allows the poo to pass out much more easily, and that can be life changing for people, and even avoid surgery if that's what people want to do.
I'll get you one for Christmas.
I was going to say, where would one procure this shoehorn?
I'll send you a link, darling.
Okay, lovely.
Christmas
And on that, we'll leave you to your shit.
Yeah,
go and buy a shoehorn.
We must say, with everything we've just mentioned in this quick dump, you must see a professional if you think you've got any of these conditions.
Yeah, please don't self-diagnose, and please don't say, oh, it's just hemorrhoids. Definitely go and get it checked out.
And that's an order.